Hello dear doctor, my name is Dr. Abdul Khalid and I am your MRCP mentor at RFA, and this is an information and update about our upcoming fast track course which we are doing for January 2025 batch for MRCP Ireland as well as MRCP UK. And in this fast track group we will do the MCQs from the past papers, in which I will explain to you all the MCQs in details, their options, their insight of asking by the right colleges, and I will explain to you how to approach the MCQ, give correct answers. I will give you all the tips and tricks to go through the exam and give the correct answer for your definite success. So let's start from this MCQ, which is from MRCPI-1 January exam 2017, and this is a scenario of an 18-year-old male who is reviewed in cardiology clinic after the sudden death of his father at the age of 42 years. You understand that one of his uncles died suddenly without any past medical history. Here the past medical history of note, he doesn't had any past history of note, although he does admit to having been lightheaded after a run a few months ago. And on examination, his blood pressure is 118/82, his pulse is 62 beats per minute and regular, there are no heart murmurs, and his chest examination is clear. And with regard to the investigation, his hemoglobin is 13.7 gram per deciliter, WBC 6.2, platelet 192, sodium 138 millimole per liter, potassium of 4.9 millimole per liter, creatinine 18 micromole per liter, and ECG showed sinus rhythm with a QTC of 510 milliseconds, and 24-hour tape shows frequent ventricular ectopics but nil else of note. With regards to the options for the management of this patient, and the question is being asked, which of the following is the most appropriate intervention? So the option number A is amiodarone, then beta blockade, flecainide, high stellate ganglionectomy, and option E is implantable cardioverter defibrillator insertion. So with regards to this MCQs, first of all, just see in this MCQs they are asking which of the following is most appropriate intervention. So you can understand the question is asking about the appropriate intervention. It's not asking about the definite treatment, it's not asking about the treatment or treatment in the acute setting. And if you go through the MCQ, it doesn't says you about any history of collapse in the past, but in the ECG we have found that if you can see, the ECG tells us that QT is prolonged in this case. So with regards to this MCQ, the most appropriate intervention here is beta blockade. If we talk about the other options, so if we say about amiodarone, as we know this is treatment for ventricular tachycardia, but it also prolong the QT, which again will increase the risk of developing the arrhythmias and leading to ventricular fibrillation. And as well as about flecainide, also this also increases the risk of arrhythmia, so that's why this is also not an appropriate answer. And if we go for the high stellate ganglionectomy, this is also not the correct option. As we all know that, first of all, if you need to understand what is high stellate ganglionectomy, this is the blockage of the sympathetic ganglion, and as we all know, the sympathetic stimulation increases the heart rate, which may increase the risk of tachycardia or arrhythmia, but this is not the right answer here. This approach we use for the patient who are eligible or the candidate for implantable cardioverter defibrillator, which is an indication in the patient when they are having any history of collapse in the past. So that's also not a correct answer here. And then last option is implantable cardioverter defibrillator insertion. As I said, this is definite treatment, but in case in which we have the patient with a history of collapse in the past, so the most appropriate intervention to prevent the ventricular tachycardia in this case, where the patient is not having any history of the previous collapse in the past. So the answer is beta blockade, which we can use in this question, and this is the correct answer. So if you want to join our fast track group, please contact RFA on their WhatsApp, Instagram or Facebook group. Thank you.